Yes, the question is, of course, that some patients, of course, can benefit from the treatment, but majority of the patients fulfill not inclusion criteria, and maybe they are among those who has exclusion criteria. So some of these patients has other comorbidities, and most clinically relevant example can be treatment with anticoagulants, which is not stable every time. Maybe you will need treatment with anticoagulants because of infection with COVID, you will be immobilized, or if today topic on CONy stroke, when you have stroke, it will be limited treatment option for those patients being on antibodies treatment for Alzheimer's disease. So the population as a whole, even patients and family, has big expectation. Most of our patients will not fulfill criteria we cannot treat them with those antibodies. So majority of the patients are outside of the treatment, but of course there is some group that will be possible. It will be possible to be treated. I have to say it's not approved yet in Europe, of course. I work a lot with Swedish dementia registry, which include every patients that get dementia diagnosis, regardless the age, the comorbidities, frailty. So real patients will have, for example, 20% of our patients has diabetes, mean age is 79. So we need to take account this aspect that the current studies were, for example, limited on antibodies to 90 years old. So people who are 90 plus they were not studies basically. So all this aspect of frailty or multimorbidity, it's not taking into account. And then the focus, we are also a little bit concerned, the focus can switch to early treatment, early diagnosis, and those who are in later stages of dementia, later stages of Alzheimer. We have not many new drugs coming for those populations, so it needs to be well balanced. We need to say for this group as well some words. Of course, frail patients were excluded from the trial, so then we don't have data, but this is not only dementia, and usually in most of the other trials, in all other drugs as well, not only dementia drugs, you usually exclude in the trial, of course, patients with Alzheimer's disease, so they never participate in the other type of trials. So we need to maybe be more mature to give them possibility, because this is the way that in frailty, one of the big aspects of frailty, in fact dementia, one of the aspects of the frailty, cognitive frailty is dementia. So this is complex, but physical frailty for this trial, of course, or functional frailty was not considered because it was quite demanding protocol for Lecanemab every second week. You needed to have also study partner. So the social frailty, when you don't have anyone in your surrounding that can go with you to the study clinics and be on your side all the time, it's an issue, because all antibodies studies were done with someone who had dedicated study partner. So the social frailty, when you are alone and your social network is quite, it's not so developed, then it can be an issue. So we need to look more in the real life again from the registry base for physical frailty, for social frailty, for functional frailty, for different aspects of that.